Good afternoon, friends. Welcome to the welcome, friends. Welcome to the sixth session of Medical Radiography and Imaging Technology students. Dear friends, this is the sixth session, the sixth day of X125. And this sixth session are Shrikant Sharma Tilawat ji and Nandita Mane madam. Friends, on behalf of you, may I Shrikant Sharma ji madam.
Namaskar, namaskar.
Good afternoon, Nandita madam. Namaskar, namaskar.
Good
Most
afternoon,
welcome, sir.
Namaskar.
Most welcome, ma'am. Most welcome.
Good afternoon, sir.
Good afternoon. Shari.
And dear friends, the judges Santosh, Kumar and Rameshwar Waghmare.
सर आपका वॉइस बहुत
हाँ,
ब्रेक
सर.
हो रहा है आपका वॉइस बहुत ब्रेक हो रहा है
स्वानंदी लवकर ये स्वानंदी
अरे सर बाहर हूँ वही तो लफड़ा है.
ठीक है बोलिए
वाघमारे जी.
Yeah, now it will be clear, I think.
yes sir
Having trouble in connection, this is often caused by an unstable internet connection.
Raji, you can speak
अपना तो if you are
From my side, is it okay?
yes sir what take pause you can start continue हेलो
हाँ आवाज आ रही है.
yes sir
डोंट स्टॉप
हाँ ठीक है. Yeah. Dear friends,
शंकर जी आपकी आवाज आ रही है.
dear friends, Shrikant Sharma ji is a well-known
Yes,
name.
sir.
He is Vice President to Society of Indian Radiographers and he is working for SMS Medical College and Hospital at Jaipur. Shrikant ji has started his career as assistant radiographer in 1981
Not listening voice.
and as a gazetted officer. He is involved in teaching and training of radiation technology students. Shrikant ji has attended international training course of radiological technologists at Belgium. He has more than 30 presentational courses. With these words, I welcome officially Shrikant Sharma ji, the guest for our sixth session of X125.
Are you listening me?
In par
Hello?
with that,
Are you listening me? Is audible?
yeah,
Shrikant sir please wait
Yeah.
Nandita Mane madam is at Mumbai, Maharashtra. She is a radiology graduate and working with Lilavati Hospital for last 17 years as a radiology supervisor.
Yeah. Hello, sir. Hello, sir.
Without fail, let me. Yes, ma'am. नंदिता मैडम का कल बर्थडे है तो हम पूरे एसआईआर की तरफ से नंदिता मैडम को उनके जन्मदिन की ढेर सारी शुभकामनाएं देते हैं.
Thank you so much, sir. Thank you very much.
Happy birthday to ma'am.
Thank you. Thank you.
Happy birthday,
Happy birthday, madam.
Yes.
Thank you.
Along with
you.
the we have Sarji works with Safdarjung Hospital, New Delhi for last 26 years as senior radiographer.
जी की आवाज नहीं आ रही.
He is postgraduate in radiology. Santosh Kumar ji was on deputation to.
और मिश्रा जी की आवाज नहीं आ रही.
मिश्रा जी की आवाज कट रही है थोड़ी.
जी आवाज नहीं आ रही.
For this sixth, dear friends, the second judge with us is Ashok Walmiki ji. His diploma in radiography in 1989.
उसमें आ रही.
Voice is not coming, sir.
Senior conferences and 2 state CMEs. With these words, I welcome Ashok Walmiki ji for this 6th session of X125. Dear friend, he belongs to President for RAM unit of Jalna. He is postgraduate in physics with 20 years of experience in radiology. He is coordinator for Swami Vivekananda Paramedical Institute. With 20 years of experience in radiology. He is coordinator for Swami Jalna. So judges ka, dear friends, let me request Nandita Mane madam to speak few words on this occasion. President, female wing of Society of Indian Radiographers.
Good afternoon. I take the privilege of welcoming respected guests, judges, and
Nandita
participants.
Mane madam.
My voice is coming, sir?
Yeah.
Yeah. Good afternoon. I take the privilege of welcoming respected guests, judges, and participants to our X125 National Online PPE competition. My special thanks to Radiographer Association of Maharashtra and Society of Indian Radiographer to trust us and give us such a beautiful platform. I would like to thank respected Dr. T.N. Mishra sir and our creative mind person, none other than respected Shankar Bhagat sir, respected K. Damodaran Naidu sir, respected K. Muniratnam sir, respected Sir Sunil Chavan sir, respected P. Ramachandra Reddy sir, respected Srinivasa Sulu sir, I thanks respected Jagdish Jagtap sir, respected Vilas Badane sir and R.P. Unchalkar sir, President of Radiographer Association of Maharashtra. Because of short time of period, I am not able to take each and every names who supported us directly and indirectly. Thank you so much, respected all Radiographer Association Maharashtra and Society of Indian Radiographers committee members. Last but not the least, my special thanks of my female wings committee members. Alone I can, but together we will. Now, I would like to tell you few reasons to make female radiographers organization. As of now, if we notice female radiographer ratio is 5%, but in the future scenario is number of female student ratio is more than 80%. That's the reason we are planning to make organization, which is the exclusive for female radiographers under the banner of SIR as female wing of SIR. My humble request to all, kindly take SIR lifetime membership as soon as possible. Email address is www.radiographers.org. Thanks once again and all the best students for your participation. Thank you very much.
Thank you, Nandita madam. Thanks for your nice words and motivational speech leadership. Thank you, ma'am. Thank you very much. Dear
Thank you, sir.
friends, I take the opportunity now to ask Shrikant Sharma ji, on behalf of you all, let us request him for his speech. Shrikant Sharma ji.
नमस्कार मिश्रा जी, आपको हमारी आवाज आ रही है? सुन रही आवाज? आवाज आ रही है? ऑडिबल?
Yes, sir. Yes, yes.
Yes, sir. Okay, sir. Good afternoon to everyone. Welcoming to all the office bearers of Society of Indian Radiographers, especially Dr. T.N. Mishra ji, Chairperson of SIR, Sri Damodar K. Naidu, the President of SIR, and Sri P.R. Reddy ji, Secretary General of SIR, and Sri Vasnu sir, Working General Secretary and National Coordinator, Sri Shankar Bhagat ji. I am really thankful to all of these. All are thankful to their hard work, by which the National Online PowerPoint Presentation Competition organized for radiology technology students throughout India and worldwide. I express my special gratitude to entire team of RAM, the Radiographer Association of Maharashtra, who gave me an opportunity to be guest of such a big event in which sharing the knowledge on the birth year of X-ray invention 125th anniversary and celebrating among all the people who are involved in the radiation field. One important thing which is noticeable that Sir Ranjan invented the X-ray and do not patent his research and gifted it to human beings for the welfare of sick patients' diagnosis. Neither it will be difficult to reach in the hands of average people. Here, I am expressing regards to Ma'am Nandita Ben, the National President of Female Wing of
Thank you,
SIR,
sir.
Judges Sri Santosh Kumar ji from Safdarjung Hospital, New Delhi, Sri Ashok Walmiki ji from Hubballi, Karnataka, Sri Rameshwar Waghmare ji from Jalna, Maharashtra, and guest lecturer Sri Anto Ramesh Delvi from Bengaluru, Karnataka, who are doing their most important job of judgment for the best presenter. Sir, SIR is working since 1981 to till date with its full capacity, and every year the conferences are organized for sharing the knowledge among all the radiological technologists. It is a matter of proud to say here that after Sri Sitaram Sharma, ex-president of SIR, Sri Mishra ji has carried out the society for a long period in the chairmanship of Sri Wajid Saab and fixed newer golden feathers in the crown of SIR. The Paramedical Allied Council Bill will finally going to be passing and regularized soon by the efforts of Sri Shankar Bhagat ji and his entire team. I also want to say to our new aspirant technologists to improve their presence in the society of acquiring the vast knowledge and spread between their colleagues. The session 6 of X125 is based on X-ray production to control controlling of infection, and up to endless possibilities in radiology. All the presenters are blessed to be here, that they have an opportunity to feel proud that they are selected in such meeting to prove themselves. Thanks once again. Jai Hind. Thank you everyone for the best of luck for the session and presentation for the new aspirants of the technology, radiology technology students. This is my blast. Thank you, sir. Thank you, Mr.
नई ऊंचाइयां छुएगा, इसमें कोई दो राय नहीं है. Dear friends,
Yes. Voice is not coming.
हेलो मिश्रा जी. हेलो.
and I will try. This thing will never happen in future. Just bear today for that. Yes, friends. So now it is the time to start with the X125 PowerPoint presentation competition. But before that, to continue as a host for the competitions, I request Randhir Kumar Ranaji to take this charge. Ranaji is my colleague at Tata Memorial Hospital. He is working. Let me tell you, as Shrikant Sharma ji said, our paramedical bill has been put in the Rajya Sabha on 15th of September and it was passed. Let us see the competition will start. Rana ji will take the charge for this. Before I leave, let me thank Rana ji to take this responsibility of carrying out the presentation competition program henceforth. Thank you, Rana ji.
Thank you, sir. Thank you so much.
Ramaji to introduce the bill.
So I introduce the bill.
Right.
Please take the charge.
And the bill for introduction, National Commission for Allied Healthcare Professional Bill. Dr. Harshavardhan from Lok Sabha Chamber.
Respected sir, I rise to move for leave to introduce the National Commission for Allied and Healthcare Professions Bill 2020.
Question is that the leave be granted to introduce the bill. Those in favor, please raise their hands and say aye.
Aye.
Those against, will please raise their hands and say no. I think the ayes have it, the ayes have it, the ayes have it. The Minister to introduce the bill.
Sir, I introduce the bill.
Hello.
Yes, Rana ji, you can go ahead. Rana ji, you can start.
Yes. Good afternoon to all and welcome to the sixth session of X125, the National Online PowerPoint Presentation Competition for Medical Radiography and Imaging Technology students. So dear friends, we are going to have our first presenter. Her name is Pranamika Thapa. She is third year student of pursuing BSc Medical Imaging Technology. She is pursuing her degree from Sri Satya Sai Institute of Higher Medical Studies, Bengaluru, Karnataka. And the title for her presentation is Processes of X-ray Generation. Best wishes to Pranamika for her presentation. Best wishes.
Good afternoon, everyone. Good afternoon, everyone. Myself, Pranamika Thapa, third year BSc Medical Imaging Technology from Sri Sathya Sai Institute of Higher Medical Sciences, Karnataka, Bengaluru. Today, I'm going to present about processes of X-ray generation. Before my presentation, I would like to express my gratitude to my tutor, Srinivasa Reddy sir, family and friends who helped me for the presentation. So contents, here I'm going to discuss about introduction, properties of X-ray, processes of X-ray generation, types of X-ray generation, general radiation or Bremsstrahlung radiation, characteristic radiation, factors affecting X-ray beam quality and quantity, X-ray energy and conclusion. Introduction. X-rays were discovered by Professor Wilhelm Conrad Röntgen, a German physicist, on 8 November 1895. The first image is of Professor Wilhelm Conrad Röntgen, and the second image is the X-ray image of hand with rings. Wilhelm Conrad Röntgen took first medical X-ray of his wife's hand, taken on 22nd December 1895. So this X-ray was the first photograph of a human body part using X-rays. So how X-rays are produced? X-rays are produced by energy conversion when fast-moving stream of electrons from cathode is suddenly decelerated in the tungsten target and anode of an X-ray tube. Here we can see the image of X-ray tube. On one side, there is a cathode arm, and another side, there is an anode arm. So the electron beam comes from cathode arm and it strikes on the anode arm, that is tungsten anode. Then X-ray photons are formed. So properties of X-ray. X-rays have a shorter wavelength of the electromagnetic spectrum, that is 0.01 nanometer to 100 nanometer. It travels in a straight line and are capable of traveling in a vacuum. And it affects the photographic film and form the latent image. It produces biological effects in living organisms, such as hair loss, fever, and damages tissue and DNA genes. Coming to processes of X-ray generation, X-ray are produced by energy conversion when fast-moving electrons from the filament of the X-ray tube interacts with the tungsten anode, that is target, then the kinetic energy E of the electron is passing across the voltage V and is increased by capital E is equals to small e into capital V, where E is the electronic charge. Then the speed electrons strikes the target and do not have the same energy. So types of X-ray generations. There are two types of generations, such as general radiation and characteristic radiation. General radiation, it is the incident electron which interacts in the nucleus of the atom. Then characteristic radiation, it is the incident electron interacts with the orbital electron of the target atom. So coming to the general or the Bremsstrahlung radiation. Bremsstrahlung is a German word meaning slowed down. So general radiation is the interaction between projectile electrons and neutrons of the target atom. So the electron enters the atom and passes through the nucleus. So electron is attracted towards the nucleus, but it is deflected from its original direction. So electron slows down and changes its direction. So in this image, we can see that incoming electrons comes in a straight line. When it approaches the nucleus, it is deflected from its original direction. So the photons are produced. So this radiation produced by this process is known as general radiation or Bremsstrahlung radiation. So this deceleration causes the electron to lose the kinetic energy in the form of new photons. So Brem's X-ray have a range of energies and forms a continuous emission spectrum. Now coming to the characteristic radiation. Characteristic radiations are the electrons which bombards the electrons in the target and it ejects from the inner orbits. So the removal of electron from the tungsten atom causes the atom to have an excess positive charge. So an electron from an outer orbital electron replaces the displaced electron. The energies of the characteristic photons are very discrete, and they represent the differences of the energy levels of the electron orbital levels. So in this image, we can see that the incoming electrons comes and strikes the inner orbital, that is K shell. Then the incoming electrons and the K shell electrons will bombard and they will go in different direction. So the vacancy is created. So the electrons in the L shell has more energy than the K shell. Then the L shell electron moves to the K shell. Then the vacancy is created. So this X-rays produced in this manner is known as characteristics X-ray. So factors affecting of X-ray beam and quality and quantity. Here, what is quality? Quality, it relates to the X-ray spectrum changes and the effective photon energy. Then quantity, it refers to the number of photons produced during an exposure. So an increase in current, that is MAS, results in an increase in quantity and no change in quality. So an increase in voltage, that is kVp, that peak kilo voltage, results in an increase in quantity and quality. An increase in target atomic number, that is Z, results in increase in quantity and quality. An increase in voltage ripple results in a decrease in quality and quantity. So X-ray energy, in Bremsstrahlung X-rays, what are produced? They are produced by having an energy level in the setup of kVp value. Then characteristics X-ray have a specific energies, and the key characteristics X-rays require a tube potential of less 70 kVp. So in conclusion, general radiation or Bremsstrahlung radiation application are mainly used in radiotherapy and general radiography. Then characteristic radiation application are mainly used in X-ray, fluorescence, spectroscopy, particle-induced X-ray emission, and mammography. So we come to know about the X-ray properties and the types of X-ray generation, that is general or the characteristic radiation, and factors affecting the X-ray beam, that is quality and quantity, and applications used. Lastly, I would like to thank the organizer of X125 for giving me this opportunity. Thank you.
Judges, you can ask the questions.
You did a very well presentation. And please say what is latent image? In your presentation, you use the word latent image. So can you
Yes,
tell
sir.
what is the latent image? What is latent image?
Sir, latent
Hello.
image, yes, sir. Sir, latent image is an invisible image produced by the exposure of a photosensitive material, sir.
Very good. Very good.
Thank
Next
you, sir.
question, next judge. Next judge.
Pranamika.
Yes, sir.
Pranamika.
Yes, sir.
I will one question you. What is scattered radiation? What is scattered radiation? You are giving good presentation.
Yes, sir.
Pranamika Thapa. But I will ask you one question.
Yes,
What
sir.
scatter radiation?
Sir, scatter radiation is a type of secondary radiation that occurs when a useful beam intercepts any object, sir.
And it is harmful of the body, human body?
Yes, sir.
Okay, thank you.
Very nice presentations, Pranamika.
Thank you, sir.
I have a question. Can you speak?
Yes, sir.
Like shaded ಮೇಲೆ.
What is between conventional X-ray tubes and those with X-ray tubes of single slice CT scanner and multi-slice CT scanner, particularly in view of cooling?
Sir, can you repeat again, sir?
I repeat this question. What is difference between conventional X-ray tubes and those with X-ray tubes of single slice CT scanner and multi-slice CT scanner, particular in view of cooling?
Sorry, sir. Don't know, sir.
Okay, any more questions, judges?
No, thank you.
Okay, thank you, Pranamika, for your nice presentation. The
Yes,
second
sir.
presenter for today is Sujith U S. He is second year student. He is pursuing BSc Radiology and Imaging Technology from Karpaga Vinayaga Institute of Medical Sciences and Research Center, Kanchipuram, Tamil Nadu. And he is going to present on xylography. Best wishes, Sujit, for your presentation. Carry on.
Okay, sir, thank you. First of all,
57, 56, 55, 54, 53, 52, 51, 50, 49, 48, 47, 46, 45, 44, 43, 42, 41, 42, 39, 38, 39, 37, 36, 35, 34, 33, 31, 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2,
good afternoon, judges. A warm welcome to my presentation. All the best wishes those who are participating today. Myself, Sujith U S, and I am representing Karpaga Vinayaga Institute of Medical Science. So my today's topic is about xylography. So we can go through the slides. First of all, xylography. In the content are, you can see the content on the slide. Okay, we can go to the next slide. Definition. Xylography is the radiographic examination of salivary gland, and it is also to study the parotid and submandibular gland. And we can use a small amount of contrast media injected into the salivary gland. So we can see the definition in there. Xylography is the radiographic examination of salivary gland. Okay. And then next, here we can see the anatomy of salivary gland. There are three types of gland in salivary. Okay, we can first one is parotid gland, submandibular gland, and sublingual gland. Here, first one is parotid gland. We can see it is the largest salivary gland in the among three of them, and it is also called duct of Stenson, and it is about 5 to 6 centimeter long, and it open in the inner surface of the cheek of the opposite of the second molar tooth. Okay, and here comes the submandibular gland. It extends posteriorly from below first molar to the angle of mandible. Okay, it extends posteriorly from first molar to the angle of mandible, and it is also called Watson duct. Okay, it is also called Watson duct, and it is about 4 to 5 centimeter long. And next one is it opened by the Watson duct by the floor of mouth by side by the perineum of the tongue. Okay, and when the last one is sublingual gland. It is the smallest pair in among three of them, and it is duct of nervous connect the sublingual gland to the floor of the mouth. Okay, and it is almond in shape. It opened by several fine ducts in the floor of mouth, either side the phylum of the tongue. Okay, can we go to the next slide? Here the picture representation of the salivary gland. The salivary gland is divided into three, and the parotid, submandibular, and sublingual gland. Here you can see the parotid gland is the largest gland, and sublingual gland is the almond in shape, and here you can see the submandibular gland. Okay, so we are going to the next slide. Types of xylography. Basically, there are three types of xylography: conventional fluoroscopic xylography, CT xylography, and MR xylography. The major indications of xylography is calculi, swelling, xerostomia, chronic inflammatory disease, mass lesion, obstructive lesion, penetrating trauma, and fistula. Here you can see that the swelling, and you get the calculi. Okay, and the contraindications. The contraindications of the xylography is allergy to contrast media, inflammation of salivary gland, and acute xylodenitis. These are the three contraindications of the xylography. And the materials needed for the xylography, first one is lemon or citric acid, and it is vitamin C tablet, and gloves, and xylographic catheter or venflon, connecting tube, plaster, 10 cc syringe, and dressing tray, and they include gauze, cotton, cups, forceps, blade handle, and kidney tray. And the contrast medium is used to the water soluble iodinated contrast, non-ionic or ionic contrast media, and iohexol it's about 240 to 250 mg per ml, and it is conclude and omnipack and contrapack, and dosage is about 2 to 3 ml until patient feel discomfort. And the preparation of the patient, any radiopaque material should be removed, example false teeth. The patient asked to remove all the metal ornament around the neck and the head, and the denture should be removed, and the patient should be in a hospital gown. These are the four types of preparation of the patient. And here comes the procedure. When the patient lies down on the table in supine position, and take preliminary films before injecting the contract. Okay, you will realize that before injecting the contract, we can take the preliminary films. Okay, and find out the salivary gland and whip out the gauze, and the lemon juice or citric acid may be sprayed over the orifice and waited for the few minutes. Orifice is slightly massaged and look for a bed of saliva, and the duct is cannulated and contrast introduced with this fluoroscopy guidance, and the contrast is oil based or water soluble iodinated 240 to 250 mg per ml. It should be injected manually until patient feel discomfort. Image will be immediately after contrast is complete, and after taking the required image, patient sucks on the lemon again to evacuate the contrast. And here you can see the pictures. The cannulation of the duct with the 22G intravenous catheter, and here the cannulation of the duct intravenous catheter to 22 gauge, and it is the dilation of the probe Watson duct, the submandibular gland. Here you can just see the pictures. And the next one is preliminary films of parotid gland. The frontal view is taken with 5-degree head rotated away from the side of being examined. We can take the films and preliminary films with a 5-degree head rotated from the side of it's being examined. So next one is the lateral centering at the angle of mandible, and the lateral oblique centering at the angle of mandible with the 20-degree cephalic angulation. It is the preliminary films of parotid gland. Here you can see the pictures of parotid gland. Preliminary films, okay. And the next one is submandibular gland of. It is inferior superior with the floor of mouth. And then the floor of mouth is depressed by the wooden spatula, and the lateral oblique centering 1 centimeter anterior to the angle of mandible. And here you can see the preliminary fillings. And the filming, here we can see the filming. This is without contrast and this is with contrast. The parotid is without contrast is like a lateral and lateral oblique. And with when while injecting the contrast, we can take the pictures like in the position of lateral and lateral oblique. In the way of submandibular gland, without contrast, we can take the image like inferior superior occlusion and the lateral. And the next one is submandibular. When we injecting the contrast, we can take the picture like inferior superior occlusion, lateral and lateral oblique. Okay, I hope you will see the picture. And the aftercare. Ask patient to rinse the mouth. Give some lemon juice to educate the patient to self-massage the salivary gland to help the express retain contrast, and painkillers can be given. Okay. And the complications. And the complications of the xylography is cyanidinitis and abscess and strictures of the duct, pain or rupture of the duct, and damage to the duct orifice. These are the complications. And we can see the positive findings like inflammatory parotid gland and stricture mandibular gland. Here you can see the, I hope you see the picture. And at last, I referred from these. So, thank you. Hello, sir.
Hello, Santosh ji, we are unable to hear you. Ashok, you can ask the question.
Hello.
Hello, Sujith. Good presentation.
Thank you, sir.
I will ask you one question.
Yes,
How
sir.
you use lemon in this procedure?
Okay, we use lemon for the we can dilate the salivary gland. We can see the, when we use the lemon, we can see the clearly, we can see the cannulation.
Very good.
Okay,
How many
you,
cases you handle? How many
no,
cases?
sir.
Why?
No, I am just a second year, sir, and our college didn't take an xylography.
You are not doing
your
institute in cases?
No, sir. I referred
and
from this,
any precaution and any precautions before you
yes, sir.
For the procedure.
Yes, sir. We can take the precautions like we have to wear the lead apron, and mainly we can the thyroid collar, sir.
And this procedure you made by fluoroscopy or manual?
Fluoroscopy guidance, sir.
This procedure. Fluoroscopy with IITV,
yes.
Image Intensified Television.
Yes, sir. Yes, sir.
Okay, good. Okay, good. Thank you.
Sir. Thank you, sir.
Very good presentation, Sujit ji.
Thank you, sir.
I have two questions.
Yes, sir.
Both X-ray and MR xylography.
MR xylography. So this MR and C. Okay, sir. Okay.
Difference both X-ray and MR xylography.
So the main difference is about, and we can three types of xylography, mainly was fluoroscopic and CT and MR xylography. When we use fluoroscopic guidance or a fluoroscopic xylography, we can see the only one image, like one option. When we use CT and MR xylography, we can see the 3D dimension. Okay, sir, and it is the most advanced technology.
Next questions.
Oh.
What are the risks of xylogram some patient?
Sorry, sir.
What are the risks of xylogram some patient?
A xylogram patient. Okay. I think it will be more painful. Sorry. Sorry, sir.
Okay, any more questions? Sir, Santosh sir?
Hello. Sir, I can't hear anything.
Santosh sir, you are not audible.
Hello.
Okay.
Yes, yes.
Yes, are you getting
Yes,
me?
sir. Yes, sir. Yes.
Yeah, Sujith, you have done very well presentation. Just a simple question: ki, what is the basic indication of doing this procedure, xylography?
Basic indication.
Yeah.
Is it the xerostomia, calculi, swelling? These are the main indication of this procedure, sir.
Okay. And how much contrast will you inject?
It is about 2 to 3 ml when the patient feel discomfort.
Okay. So will this be diluted or pure contrast?
Diluted, sir.
Diluted. Very good. Well presentation. Thank you.
Thank you, sir.
Any more questions?
No.
Any more questions, sir?
Thank you.
Nice presentation, Sujith.
Thank you, sir.
Okay, thank you, thank you. Nice presentation, Sujith. Now we are proceeding to the third presentation, and the third presenter is Kashish Gupta. Kashish, can you hear us?
Yes, sir.
Hello. Yes.
Yes,
So
sir.
Kashish Gupta is here. He is pursuing BSc Radio Diagnosis and Imaging. He is first year student from Postgraduate Institute of Medical Education and Research, Chandigarh. His title of presentation is How to Minimize Infection Transmission in the Radiology Department. So best wishes, Kashish, for your presentation.
Thank you, sir.
Carry on.
A very good afternoon to one and all present out here. Today, myself, Kashish Gupta, a part of BSc Medical Technology, Radio Diagnosis and Imaging, a first year student from Postgraduate Institute of Medical Education and Research, Chandigarh, is here to present my presentation on the topic How to Minimize Infection Transmission in Radiology Department. Here I come up with my contents: introduction, routes of transmission, transmission-based precautions, droplet precautions, airborne precautions, transportation precautions, decontamination of equipments, working condition precautions, segregation of biomedical waste, and conclusion. Introduction. Exposure of patients and healthcare workers to infectious agents may occur when patients visit the radiology department. Exposure to infectious organisms is not limited to clinical staff such as radiologists, technologists, and even nurses. Receptionists and monitoring personnel are at high risk. The use of appropriate PPE kit with proper surgical mask to prevent the cross-infection in radiology department. SARS infection symptoms occurred in most of these patients, with some patients rapidly developing acute respiratory failures. Routes of transmission. Infection transmission in radiology department occurs primarily through airborne and droplet routes and can occur anywhere at any time, maybe in a waiting area or maybe in a registration area, etc. There is an important difference between airborne and droplet infection. First of all, we'll talk about droplet infection. Droplets measuring more than 5 micrometer size carry pathogens directly from the respiratory tract to the mucosal surfaces, whereas in airborne infection, it involves the size of less than 5 micrometers. Droplets may travel up to 6 feet from the source individual in droplet infection, whereas it travels long distances in case of airborne infection. When we talk about examples, influenza virus, Bordetella pertussis comes under the droplet infection, whereas Mycobacterium tuberculosis falls under the category of airborne infection. Microorganisms that may be encountered in radiology department by routes of transmission. Direct transmission, viruses are Ebola virus, hepatitis B, HIV, herpes, simplex virus, and rabies virus. Indirect transmission, norovirus and whole enterococcus species. Droplet transmission, adenovirus, influenza virus, rhinovirus, SARS coronavirus. Airborne transmission, measles virus and SARS coronavirus. Transmission-based precautions. PPs are worn to prevent exposure from hazardous chemicals or biological agents. It may be simple as non-sterile examination gloves or may be complex such as positive pressure isolation suits worn in highly containment labs. Proper use of PPs mandated by and must be performed in compliance with the Occupation Health and Safety Administration regulation. This is a picture showing the donning and doffing of the PPE. For the donning of the PPE, first of all sanitize your hand, then put on the gown, then surgical mask, then goggles, and then pinch on the gloves. For respiratory protection, use a surgical mask or upper. For eye protection, use goggles and a face shield. Doffing. Doffing is the most important part of any PPE. First of all, pinch off the gloves, then your gown, then goggles, and then the respirator. And at last, sanitize your hand with at least 75% of ethyl alcohol. Droplet precautions. Transmission of pathogens such as adenovirus, influenza virus that is spread by close contact of mucous membrane or respiratory tract with infected respiratory secretions. The greatest risk of organism transmission is within 3 feet from the source individual. Healthcare workers with respiratory infections should avoid direct patient contact or wear surgical mask when in proximity to patients. Airborne precautions. Non-immune healthcare workers should avoid the care of patients with measles and varicella zoster virus. Airborne precautions are implemented to reduce the transmission of pathogens such as Mycobacterium tuberculosis that travels over long distances. A negative pressure rooms may not be available in radiology department for aerosol generating patients, so local exhaust ventilation devices should be used in this critical situation. There is an important difference now between a surgical mask and N95 particulate respirator. When we talk about surgical mask, it protects the wearer from the blood and body fluid splashes and reduces the body transmission. This is a tri-layer surgical mask. Now we will talk about the N95 particulate respirator. It filters out at least 95% of airborne particles but does not provide the same degree of fluid imperviousness as surgical mask. This is a picture showing N95 that is approved by CDC. Transport precautions. To reduce the spread of infections associated with the patients, limit the transportation of these patients to essential diagnostics and therapeutic procedures that cannot be performed at the bedside. Both healthcare workers and patients should use PPE during patient transportation. Infectious or draining skin lesions should be wrapped. Consider the route of transportation and limit the amount of patient exposure to public hallways and non-essential personnel. Decontamination of equipment. Decontamination is the process by which the microorganisms burden of a surface is reduced to a level that is considered to involve no risk of transmission of disease to an individual. Most instruments used during radiologic procedures are reusable and it may transmit infection from patient to patient if not properly disinfected. After each examination, equipment must be disinfected by wiping the surface using 75% of ethanol. Corrosive disinfectants not allowed. Disinfectant spray should be used carefully as it can lead to short circuit inside the equipment. A picture showing eco shield that is used in our department of radio diagnosis and imaging at EGIME at Chandigarh for the decontamination of equipment. EcoShield is a non-toxic, environmental-friendly disinfectant for critical area fumigation and surface disinfection. It is a complex formulation of stabilized hydrogen peroxide, 11% weight by volume, and silver nitrate solution, 0.01% weight by volume. Other disinfection. Floor should be disinfected by using 2000 milligrams per liter disinfectant containing chlorine. Exception is chlorhexidine. Furthermore, any other objects such as door handles also can be disinfected. Reusable protective products must be soaked in 1000 milligrams per liter disinfectant containing chlorine or 75% ethanol for 1 hour. Personal protection levels. Protection is important when working in areas with proven contaminated zones, so there are various levels designed for protection. There are 4 levels of protection: general protection, primary protection, secondary, and tertiary. First of all, we will start with the general protection. It involves wearing work clothes, disposable medical mask, work caps, and gloves. Primary protection. It is suitable for pre-examination and triage area, wearing disposable work caps, medical mask, isolation gowns, latex gloves, strictly implementing hand hygiene. Secondary protection. It is suitable for medical staff who has close contact with suspected or confirmed patients, wearing disposable work caps, protective goggles, face shield, medical mask, isolation gowns, latex gloves, shoe covers, and strictly implementing hand hygiene. Now at last, there is a tertiary protection. It is suitable for aerosol generating patients such as respiratory sampling, which may cause spraying of respiratory secretions, wearing disposable caps with face shield. Working condition precautions. Polluted area, semi-polluted area, and cleaning area needs to be strictly separated and disinfected. If a dedicated examination room cannot be separated from others, strict equipment disinfections are required after the current patient scan and between the patient encounters. Special ventilation devices, air conditioners used in some special areas like intervention labs, PSAs, etc. That includes various types of filters including P filters, microfilters, and HEPA filters. An independent medical imaging examination needed, and different working areas should be strictly separated. This is a picture showing X-ray room of our Department of Radio Diagnosis and Imaging in PGIMER Chandigarh. These are the working condition precautions for this room. Clean the surface of room and equipments using hospital-approved methods. Seal the radiology room with tape and plastic covering doors and vents. Implement hydrogen peroxide vapor decontamination. Biomedical waste management in radiology department at PGIMER Chandigarh in color-coded bags. In PGIMER, there is a proper and intellectual technique of waste management. When waste collected, it is transported to collection van with proper precautions, and then it is disposed of with various techniques. It may be incinerated, may be deeply buried, or it can follow dry heat sterilization techniques, and then it may be recycled. All the incinerated waste goes into the yellow bag, and then it is recycled and then made to use again. Keep separate color-coded bags in department with proper segregation of waste management. As precautions, double-layered bags should be used for the collection of waste from department, and it should be tied. There are 4 bags that are used in our department for the management of waste. First of all, we will talk about the red bag. It includes plastic waste, gloves, bottle sets. Yellow bag, it includes all chemical waste, PPE kit with surgical mask, all microbiology waste. Blue bag, it is being replaced with a white container associated with a blue lining. It includes glassware waste, medicine waste. White bag, it includes the metallic sharp waste like needles, scalpels, and plates. Disposal of medical waste from radiology department. First of all, we will start with the segregation at the point of generation, transportation of waste to reduce collection point, then transportation, and then recycling of plastic, glass, and metallic sharp waste. Precautions for medical staff in radiology department. For radiographers in bedside X-ray, specific precautions needs to be arranged to carry out bedside X-rays in key areas. These radiographers needs to implement secondary level of protection. They can also expose towards the respiratory secretions after each and every examination. Equipment should be disinfected using 75% of ethanol. Staff in key and non-key areas. Staff for patient registration or in cleaning areas in a non-key area should take the primary level of protection. When working in contaminated zones, takes a secondary level of protection, and any material being in touch with a suspected or confirmed patient should be stored safely. Now we will move towards the conclusion. It is imperative that the radiology staff understands the various routes of infection transmission and implements transmission-based precautions when necessary to protect patients and other staff. This includes proper use of PPE. At the completion of each radiology examination or procedure, the proper decontamination of reusable items and environmental surfaces must be undertaken for the protection of the next patient who will be exposed to the same equipment again. Radiologists, radiological technologists, and nurses must have a great command of the individual protection and disinfection procedures when working in radiology department, especially in the key areas. Acknowledgement. I gratefully acknowledge the whole team of X125 National Online PPT Competition for giving me a high-rise platform to develop my skills. I am short of my words to express my deep gratitude towards Sir Mr. Lalit Kumar Gupta, serving as a lecturer in Department of Radio Diagnosis and Imaging at Postgraduate Institute of Medical Education and Research, Chandigarh, who supported me right from the front. With a sense of regard and reverence, I take this opportunity to express my gratitude towards my colleagues and my friends for their cooperation. This is a picture showing an open hand monument in Chandigarh. It is the emblem and symbol of Government of Chandigarh, and it symbolizes the hand to give and hand to take, peace and prosperity, and the unity of mankind. Thank you.
वेरी नाइस प्रेजेंटेशन कशिश, बहुत ही अच्छा प्रेजेंटेशन किया आपने, रियली आप धन्यवाद के पात्र हैं। ओके, नाउ क्वेश्चंस फ्रॉम आवर जजेस। सर क्वेश्चन, संतोष सर।
Yes, Kashish Gupta. Yes, Kashish Gupta.
Yes, sir. Yes,
you
sir.
are first year student, and you are first year student. You are chosen a very vast topic of infection control. It's really appreciable.
Yes,
Please tell, can you tell what is the role of radiographer in biomedical waste?
Yes, sir. Can you repeat?
Radiographer, what is the role of radiographer for biomedical waste in his department?
Sir, radiographer can. Yes, sir.
Yes, sir. Say, please say.
The radiographer in waste management, it can manage the waste properly by using the developers and chemicals that are used in conventional radiography, and also when nowadays as a pandemic is going on in COVID-19 cases, the radiographers can use the proper techniques of infection prevention and in biomedical waste segregation also.
Very good, very good. And how you use the precaution in triage area?
Yes, sir.
Do you have triage area?
So we can take the primary. So we can take the primary protection. So we can take the primary level of protection when in suspected patients, and when in confirmed patients, we can take the secondary level of protection.
Very good. Next judge.
Ashish.
Yes, sir.
Ashish, well presentation. Well
Thank
presentation.
You,
this COVID pandemic season.
Yes, sir.
I will ask you, how do you explain infection control to the patient?
Yes,
how
sir?
do you explain infection control to the patient?
Infection control in patients, sir?
How do you explain?
Sir, we can limit the patient transportation in a triage or emergency areas because patient transportation can lead to infection transmission in various peoples, and also to the medical staff also.
Okay, sir. Have you got your answer? Next question.
Hello.
Yes, sir.
What is the most common? Hello, Kashish.
Yes, sir.
Hear my voice?
Yes, sir.
What is the most common cause of hospital required infection?
What
is the most
sir,
common cause of?
Sir, it may be transmission by various routes, maybe droplet transmission, airborne transportation, the transportation routes, droplet routes, indirect routes and contaminated areas also.
Okay, very good. Thank you.
Okay, sir.
Rameshwar, sir.
Very nice presentation.
Thank you, sir.
Asking one question.
Yes, sir.
In COVID-19 conditions, we are using sodium hypochlorite. Is it hypochlorite dose? It is necessary the scanner.
Sir, can you repeat?
I repeat. In COVID-19 conditions, we are using sodium hypochlorite dose. Does it necessary the scanner?
No idea, sir.
Next, is fumigation with the formalin recommended in CT MR scanner?
No idea, sir.
Any more questions, sir? Rameshwar, sir.
Thank you.
Okay, thank you, Kashish.
Okay, thank you.
Okay, sir.
So we are moving to our next presenter. And she is Manisha Pradhan. Manisha Pradhan. Hello, Manisha. Can you hear me?
Yes, sir.
Okay. I welcome you, Manisha, for your presentation. She is intensive student pursuing BSc Radiography from NIMHANS, Bengaluru, Karnataka. She is going to present on obstetric MRI. So, best wishes for your presentation. Manisha, proceed.
Very good afternoon to everyone. This is Manisha Pradhan. I'm a BSc Radiography internship student from the Department of Neuroimaging and Interventional Radiology, NIMHANS. So let's start with the introduction itself. MRI obstetrics. Obstetrics is the branch of medicine and surgery which deals with childbirth and midwifery. We'll go through history, anatomy, indications and contraindications, techniques, protocol, applications, advantages and disadvantages with comparison to ultrasonography, and conclusion. Let's start with the history itself. MRI was first performed in 1983 for evaluation of the placenta and fetus. Main drawback of MR was fetal motion, which was overcome in 1990s with the development of ultra-fast sequences. According to Safety Committee of the Society for MRI, no known biological risks have so far been proven to be associated with MRI. But acoustic noise and some biological effects like teratogenic effects are the main safety concern for fetal MRI. And also the noise by the gradient coils may reach up to 120 decibels. Anatomy. With advanced gestations or the embryonic development, fetal organs such as lungs and kidneys show significant changes in volume and T2-weighted signals. Amniotic sac, a thin-walled sac that surrounds the fetus during the pregnancy. The fluid which surrounds the fetus is called as amniotic fluid and the membrane is called as amnion. Uterus, it's a pear-shaped organ in between the bladder and the rectum. It sheds its lining every month during menstruation. A fertilized egg or ovum becomes implanted in the uterus and the fetus develops. Cervix, the lower part of the uterus that extends into the vagina. The cervix and the vagina collectively form the birth canal, fetus, an unborn baby from the 8th week after fertilization until birth, placenta, an organ shaped like a flat cake. It only grows during pregnancy. The fetus takes in oxygen, nutrients, and other substances from the placenta and gets rid of carbon dioxide and other wastes. Umbilical cord. It is called as the connecting link between the mother and the fetus. So it contains two arteries and a vein. It carries oxygen, nutrients to the fetus and also waste substances away from the fetus. So let's come to indications and contraindications. In case of confirmation or further evaluation of the inconclusive or occult sonographic findings for intrauterine growth retardations, in case of oligohydramnios, a condition in which the amniotic fluid is very deficit, placental abnormalities like placenta previa or accreta, moral pregnancy, evaluation in high-risk pregnancy, fetal lung and CNS assessment to assist in prenatal and postnatal interventions. Contraindications, aneurysm clip until and unless it is made of titanium for claustrophobic patients. Gadolinium is highly contraindicated as it seems to cross placenta and rapid appear in fetal bladder and excreted into the amniotic fluid. So gadolinium should be given only when it is very required. Then metallic implants and pacemakers until unless these are MR compatible or conditional. So technique, fetal MRI should be performed in the second or third trimester because the cerebral parenchyma is well appreciated after the 16 weeks of gestations on a 1.5 Tesla MRI. So let's start the patient preparation. Before taking the patient to scanner room, ask the patient to sign the consent or by the relatives. So ask the patient to be nil per oral for 4 hours prior to the study. This is done to reduce the bowel peristalsis artifacts and also to prevent postprandial or after food fetal motion. Empty bladder prior to study. This is done one for the comfortability of the patient. Second, to visualize the cervix and lower uterine segments. Patient positioning, feet first supine or in left lateral decubitus position. Left lateral decubitus position is more recommended because it reduces the chances of hypotension due to compression in the inferior vena cava. A single body metric coil is often used over the abdomen and the pelvis to improve the spatial resolution. Imaging is performed during free breathing with respiratory gating to avoid artifacts. Center the laser beam localizer above the mid-abdomen. Coming to the protocol part, MRI should be such to overcome the limitation caused by fetal motion and maternal breathing, such by using the parallel imaging techniques like GRAPPA with different IPET factors. MR protocol should be tailored to minimize the SAR in a pregnant patient by reducing the number of slices or by decreasing the flip angle. Then a single shot localizer is taken in all the 3 orthogonal planes. Then these are the sequences: T2 trophy in sag, coronal, axial orientations with breath hold and with different thick slabs. Then T1 5 axials and T2 trophy axial in oblique coronal. HAST or half Fourier single shot fast field echo or SSFE images are obtained in 3 orthogonal planes through the lower abdomen and pelvis in breath hold conditions. T1 axial wipe is done to rule out any hemorrhagic changes. So for sagittal planning, put the planning FOB, open the coronal localizer where it is parallel to the placenta. On the axial, it is perpendicular to the placenta. For coronal planning, place the planning FOB on your sagittal localizer where it is parallel to the placenta and perpendicular to the placenta. For axial planning, put the planning FOB over sag or coronal localizer where it is perpendicular to the placenta. For oblique axials, it is done to rule out for any deformity in the birth canal. In sag, perpendicular to the birth canal. In coronal, parallel to the left and right IC. To reduce the SAR deposition in fetal MRI, half Fourier single shot rapid acquisition with relaxation enhancement technique is performed in the fetal 3 orientations. Then a typical sequence for fetal using an echo spacing of 4.2 millisecond, T effective of 60 millisecond, and echo trend length of 72 with 4 mm section thickness. Then a 1 second delay is kept within image acquisitions which minimize the SAR and also limit image artifacts. Fetal protocol technique will be same as patient positioning, same as a maternal MR. T2 weighted imaging after getting scout from the fetus. HIST with rare in all the 3 covering only fetus in the FOB. Then for fetal anomalies to rule out for any CNS and non-CNS anomalies. For diffusion weighted image is done to rule out hypoxic ischemic changes. Application in case of maternal MR to rule out for adnexal masses, ectopic pregnancy, placenta previa and intrauterine bleeding, pelvimetry, pelvic deep venous thrombosis, abdominopelvic pain. For fetal MRI, same as I told, CNS, non-CNS anomalies, encephalocele, a famous procedure called ex utero intrapartum treatment, thoracic abnormality. Then these are some of the case studies. So this is a case of adnexal masses. It's a T2 trophy sequence in the sagittal orientation. The hyperintensity small dots is the small masses outside the uterus. Then red arrow showing a thrombus in left common external iliac vein. It's a case of deep venous thrombosis. Then A and B are the images. This A is the image of T2 weighted case sequence of placenta previa, and B is showing placenta previa, which is leading to intrauterine bleeding. Placenta previa is a condition when the placenta blocks the opening of the cervix, and this increases the risk of bleeding in the end of the third trimester. Then it's a T2 weighted with fat cell image of ectopic pregnancy. You can see the placenta growing above the uterine cavity. Moving to the case studies for the fetal part, the arrowhead showing lobulated cystic mass protruding from the neck. These all are images of the T2 weighted case sequence. It's a case of encephalocele where there is a protrusion from the skull base, cortical cleft where there is a discontinuation due to developmental error. Then it's a case of CCM called cystic adenomatoid malformation where cystic mass developed. Then it's a case of CDS, that is congenital diaphragmatic hernia. It's also a congenital deformity. And finally, the exit procedure. Then coming to advantage and disadvantage with comparison to ultrasonography, antenatal ultrasound will provide you with real-time display and it's non-invasive, whereas MRI will give you superior spatial and soft tissue resolution. Ultrasound is operator independent, whereas MR is relatively operator independent. Ultrasound will provide you small FOB and difficult in obtaining multiplanar views. In MR, it gives you large FOB and is with multiplanar capacities. Ultrasound will give poor image quality in case of oligohydramnios and maternal obesity, and MR give better fetal anatomy delineation. It's independent of fetal position and maternal obesity. But reverberation artifacts and maternal bowel gas are problem under antenatal ultrasound. But MR also poor visualization with less than 16 weeks of gestations. But ultrasound is cost effective and is readily available. But MR is expensive, time consuming, claustrophobic, and also magnetic field effect and is less availability. Here I conclude as MR allows excellent detailed visualization of the fetus in utero as well as pregnancy structures. By using a systemic approach, fetal MR is useful in recognition of the developing fetal anatomy, detection of subfetal abnormalities, and evaluation of complex lesions. Prenatal MRI can facilitate management such as fetal surgery for the surgeons or guide therapy or consideration when delivery is expected to present unique challenges. Last but not the least, stay home, stay safe. Thank you.
Really, Manisha, very nice presentation. You have really worked hard to collect all the information. Really great. So questions, sir, Santosh sir, Ashok sir, judges. Hello.
Yes, sir.
You can hear Rameshwar sir.
Yes.
Hello.
Hello. I'm here.
Okay, you can ask questions, sir.
Good afternoon, Manisha.
Good afternoon, sir.
I have two questions. First,
yes, sir.
Ideal age of fetus to be scanned in weeks, more than 20 weeks, 28 weeks, or lower than 28 weeks, because
yes,
of
sir.
movement of fetus.
Yes, sir, you're true. But we have, with advancement of the techniques, we have true fist or haste, which we can acquire the images less than like 30 seconds or 45 seconds. So yes, it is true. The fetus has to be done after 5th week of gestational period. But with the true fist, which is a balanced echo sequence, or with haste, which is a turbo spin echo sequence, we will able to acquire the images in various orthogonal planes and also in various orientations, which will also less the motion related from the fetus.
Next, is it really good to
Manisha,
do the
well presentation.
ultrasound?
Yes, sir.
I
Sorry,
think
sir, I
Rameshwar
didn't
sir
get.
is a heavy question, no?
Yes.
Ashok sir, you can ask question.
Manisha,
Please,
well
sir.
presentation.
Thank you, sir.
Manisha, well presentation.
Ji, thank you,
Why
sir.
CT and X-ray not preferred for OBG?
Sorry, sir.
CT and X-ray not preferred for OBG.
Sir, well-known CT and X-ray are associated with radiation risk to the patient. But yes, maternal MR should be performed only when it overweighs the benefit to the female. Then CT and X-ray, yes, to be done only when the referring physician is given, and till 5 millisievert we can expose the fetus.
Very good. What care will
Thank you, sir.
you take for OBG patient in this pandemic?
Yes, sir. As well, means as fast as the patient arrives in the department, I will make sure the patient is wearing a mask, and I will ask the patient to sanitize properly. Then before making the patient to lay down on the imaging table, I will ask or I will clean with the sodium hypochlorite solution. I will clean all the like touching surface with a high means susceptible for infections, and to keep a safe distance from the patient as well, because since we are always in primary contact with the various patients, we may the potential carrier of the this pandemic virus, COVID-19 virus. So I will make sure to maintain a safe distance from the patient with the mask on both sides, for me also and for the patient also, and sanitize before touching the patient or before positioning or before touching any of the instruments that are coming in direct contact with the patients. Thank you.
Well, Manisha. And the last question: can we
Ji,
do
sir.
this procedure by giving contrast?
Uh, Contrast safety issues are not yet confirmed, sir, according to American College of Radiology or Gynecology. But yes, contrast can be given only when, in case of placenta previa or in case of pulmonary embolism. And contrast administration is recommended only when it is highly necessary to rule out for any pathologies. Until and unless, or it should be avoided, because its complete safety issues has not yet been confirmed.
Thank you, Manisha. Thank you.
Thank you, sir.
Santosh sir.
Yes, Manisha, you had very well presentation. You were very, very fast, but you were good. Excellent. So please,
you,
you have not tell about the consent of the patient. Whether you will take as per PNDT Act, is it mandatory before MRI procedure to be taken?
Like PNDT Act, according to 2003, PNDT Act is very essential for ultrasonography. For MRI, we have, along with PNDT, we have another form, that is Form F. So in that, we will make sure first from the referring clinician, then secondly from the radiologist, and taking a proper consent from the patient by explaining what the patient has to go through, till what time she has to lay down, and all the safety related issues to the examinations.
And the sex determination is also not allowed.
Yes, sir. Sex determination is prohibited completely.
Not allowed. So this will be mandatory displaying the board?
Yes, sir. This is mandatory because the patient may sue us in the future. So we have to make sure. Yes, sir.
Yeah. Yes. Good. Excellent. So one more question. When these pregnant patients are more uncomfortable while lying down in the MRI.
Yes, sir.
So what precaution will you take? Because once you have positioned them and you have come out of the gantry room, so what is the precaution you will take for them?
Yes, sir. First of all, if the patient is not able to lie in complete supine, I will make the patient to be in left lateral decubitus position, which is although comfortable for the patient, because for a gravid patient of significant size, it will give less compression on the inferior vena cava. Secondly, if the patient is very restless or the patient wants to, then I will stop the scanning, ask the patient to rest for some times. Again, I will counsel the patient, then again I will take back.
Okay. You also give some buzzer.
Yes, buzzers are, yes, sir, is there. Means to warn us if
Very
the
good.
patient is very good.
Yeah, yeah. Very good. Very good. Very good. Thank you.
Sir. Thank you, sir.
Very nice, Manisha.
Thank you, sir.
I can see in the chat box there are so many senior technologists and our guides also, like Pawan sir, Shrikant sir, Naresh sir. They all are having some chat and they are really motivating the presenters. We expect this and we are really thankful to all of you. So we are having our next presenter, N. Thamarai Selvi. N. Thamarai Selvi has connected.
Good evening, sir.
Welcome. She is third year student of BSc Radiology and Imaging Science Technology. She is pursuing her degree from Dr. MGR Educational and Research Institute, Chennai, Tamil Nadu. I welcome you and really I give you best wishes for your presentation. She is going to present on balloon valvuloplasty for aortic valve stenosis. Best of luck. You can start, Samran.
Good evening to everyone. Myself N. Thamari Selvi from Dr. MGR Education and Research Institute, Chennai. My topic is about balloon valvoplasty for aortic valve stenosis. First of all, going to see about what is meant by balloon valvoplasty. Balloon valvoplasty is a cardiac interventional procedure which is done to open up the stenosis or stenotic heart valves using the catheter which has the balloon on the tip. It also known as the balloon valvoplasty. Next is the types. Based on the heart valves is based on the which is valvoplasty procedure which is classified into percutaneous balloon tricuspid valvoplasty, percutaneous pulmonary valvoplasty, percutaneous balloon mitral valvoplasty, and percutaneous balloon aortic valvoplasty. Next is the anatomy. The anatomy is a four-chambered blood pumping organ in the chest cavity. Blood flow from one chamber to another through the valve. It has tricuspid valve, pulmonary valve, mitral valve, and aortic valve. Next is the indication. With ongoing age, any infection or congenital heart defect causes the heart leaflets of valve to become stuffed or calcified, hence causing to it. It has the main indication of aortic valve stenosis. Aortic valve stenosis is a narrowing of the aortic valve resulting obstruction of blood flow from left ventricle to the ascending aorta during systole, and calcified aortic stenosis and congenital aortic stenosis. Next is the contraindication. Tumor, presence of moderate to severe valvular decurtations, infective endocarditis, irreversible non-cardiac disease. Next is the patient preparation. Briefly explain about benefits and risk of the procedure to the patient. Nil per oral for 6 to 8 hours. Previous history should be taken. Consent form must be obtained. Patient should change the hospital gown. Next is the pre-procedural care. blood investigation, bleeding time and clotting time, and cardiac function. Cardiac function are the method of identifying the heart condition associated with the healthy and unhealthy pathological heart functions. Next is the pre-procedural care. Chest X-ray, ECG, CT, ultrasound, and echocardiography. Next is the pre-investigation. Next is equipments and material requirements. X-ray unit with equipments and material requirements. Next, sir. X-ray unit with fluoroscopy, wide facility, and puncture needle, vascular shift, guide wire, balloon catheter, 23 mm diameter balloons are used. These are the materials used in this procedure. Next going to see about procedure. The procedure is performed under local anesthesia. Incision site is cleaned with antibiotics. The cell danger needle is inserted through the artery and it is needed. When pulsating blood is returned, the stylet is removed. The guide wire is inserted into the needle, in which the help of guide wire catheter is inserted under the fluoroscopic guidance. Then the contrast is injected through the catheter. The catheter and valve. Once the catheter reaches the position, the balloon is inflated and the calcified valve leaflets are opened. When the calcified deposits within the leaflets and the stenosis, the balloon is deflated and removes the catheter. Next is the complications. Pain, swelling in the incision site, infection, heart attack, abnormal heart rhythms, arrhythmia, vessel damage, bleeding of or hematoma, and ventricular rupture. These are the complications. Next is the post-procedural care. Complete bed rest for 24 hours. Observation of bleeding at puncture site. Patient vital signs should be monitored. Next is the case presentation. Some of the examples of case study. Case study 1. In 3-month impact in history of severe congenital aortic stenosis. Balloon inflammation centered at the aortic valve with rapid right ventricular pacing. After the balloon valvoplasty, documenting absence of aortic insufficiency. These are the second case study 2. 80 years with male patient of 80 years, history of severe calcific aortic stenosis with complaints of progressive dyspnea. The inflation of the valvoplasty is placement of the guide wire during inflation of the balloon. Let's conclude of my topic. Balloon valvoplasty is a procedure which provides immediate relief to patient from blood vessels stenosis problem, and it is minimally invasive procedure compared to the surgeries. The procedure is to insertion and the eye successive rate. Thank you. Thanks for this wonderful opportunity. These are my references. Thanks for
Summarize, Selvi.
Yes,
sir.
Well presentation.
Thank you, sir.
I will ask you one simple question. Why is it not done in CT or MRI? This procedure.
This fluoroscopic guidance is used, so not CT in MRI, sir.
We doing no CT, the cardiac CT. This procedure, cardiac CT.
Yes, sir.
This is possible, no?
Yes, sir.
And how much contrast is used in this procedure? How much contrast?
40 to 60 ml, sir.
What?
40 to 60 ml, sir.
40 to 50 ml.
Yes, sir.
In which contrast, ionic or non-ionic?
Non-ionic, sir.
Non-ionic. Okay. Thank you.
Thank you.
So, Selvi, well presentation.
Thank you, sir.
Yeah. Say, what is the role of radiographer for this balloon valvoplasty? What will be the role of radiographer for this procedure?
Sorry, sir.
Summarize.
Sir,
Say. What will be the role of radiographer? What you will do in this procedure?
to sorry, sir.
Okay.
Don't know, sir.
And okay, what kind of X-ray machine will you use for this?
Biplane Siam, sir. Biplane
Siam.
Siam is used, sir. Ah, sir.
Biplane. Fluoroscopic.
Yes, sir.
Are you doing this? Are you doing this procedure?
No, sir. Not facility in this
No worries.
hospital,
Thank
sir.
you. No problem.
Rameshwar, sir.
I have one question. Very nice presentation.
Thank
How to monitor post-procedure 2D echo, MR, and or cardiac CT?
Sorry, sir. Audible?
I repeat.
Not audible, sir.
How to monitor post-procedure 2D echo, MRI, or cardiac CT? How to monitor you after procedure?
Cardiac CT, sir. CT. Cardiac CT, sir.
2D echo, MRI, or cardiac CT? How to monitor after procedure?
Don't know, sir. Sorry.
Any more questions, sir?
No. Thank you.
Thank you, Thamrai. Thank you for your presentation. Now we are going to proceed for our next presenter. She is Zulfarin Pangode. Welcome, Zulfarin. She is second year student of Bachelor's of Science in Medical Imaging Technology. She is pursuing this course from Goa Medical College, Goa. She is going to present on X-rays, birth of endless possibilities. Zulfarin, best wishes. Proceed on. You can start your presentation, Zulfarin.
Thank you, sir.
मैं उसमें रखते हैं
Zulfarin?
Yes, sir. Starting. 1 minute.
Okay.
Have you ever been in pain, either because you're the one affected or because you can see your loved ones in helplessly painful situations? The howling and the screams, they were absolutely terrifying, weren't they? But my friend, that is the that was the exact situation after meeting a bone injury a little over a century ago. This unqualified quack in the form of a bone setter was purely driven by gut feeling to assume your condition and to manipulate it. Why do you think we don't meet the same fate today? What could have been the life-changing event that led to the eradication of such painful traditions? A very good evening, esteemed judges, ladies and gentlemen, fellow companions. My name is Zulfarin Pangode from Goa Medical College, and I am present today on the topic X-rays, the birth of endless possibilities. Until November 8, 1895, physicians had no access to pictures of what was happening inside a patient's body. On that fateful day, Sir W.C. Ranjan discovered X-rays while working with the Crookes tube and hence set in motion a revolution in medical diagnosis. Radiographs could now roll out truths hidden deep within the skin and flesh in minutes. Diagnosis of fracture, osteoarthritis, or even bone tumors was possible with a single X-ray image. Not just that, dental procedures including tooth location, diagnosis of pathology, or even to sculpt that beautiful smile of yours is heavily dependent upon X-ray modalities. With the advent of X-rays, the best treatment could be planned, recovery time could be precisely calculated, and medical errors could be minimized. Needless to mention that all of this was possible in a couple of minutes, non-invasively, and most importantly, with utmost patient comfort. Going a step further in innovation, mammography is now the mainstay of detection and diagnosis of early breast cancer. Fluoroscopy was devised a year later by Sir Thomas Edison, and it paved the way to real-time imaging of pathologies anywhere in the esophagus or in the GIT. Techniques such as intravenous urogram are to this date the gold standard for obstructive uropathy. The first cardiac angiography was done by Mr. Werner Fossman, and the first cerebral angiography was done by Maniz, and they both won Nobel Prizes for their contributions. Computed tomography. It is one of the most spectacular innovations in human history. Displaying soft tissue contrasted with anatomical detail facilitated great diagnostic accuracy, focusing on a certain part at a certain depth and customizing the height of each slice of the anatomical detail required was wholesome and a satisfying diagnostic feat achieved. CT scanning is the modality of choice in trauma centers to image even simple fractures or even serious complications like an intracranial hematoma or hemorrhage. Laminoplasty procedures use an air drill to make a gutter in the lamina. Plain CT and contrast CT, the evaluation with this is important so that while using the air drill, they do not use it excessively and hence they will not injure the dura mater or nerve root or the spinal cord. Coronary angiography, CT perfusion is used for detection and quantification of cerebral stroke. It allows the patients to effective embolectomy within 24 hours of onset of symptoms. Another frontier is cardiac coronary angiography, and it is used in setting of low to moderate chest pain and it is non-invasive method which has been proven very helpful. CT is a modality of choice for staging cancers and to check for metastasis. CT has also been the unsung hero for the diagnosis of lung infection in this pandemic. In the newer researches, we have phase contrast mammography. Phase contrast mammography promises to be the new and the next generation mammography. Clinical trials have already been underway at the Italian synchrotron Electra. Allow me to explain. In the conventional mammography, breast tumors appear visible only because of a slight change in density around the tumor and the normal breast tissue. But in phase contrast imaging, since it improves the contrast of the image, even between the soft tissues, if there is any pathology, it can be more readily be visible than as compared to conventional radiography. The company Konica Minolta has already manufactured a laboratory-based contrast mammography unit. Phase, phase contrast imaging has not yet become the standard clinical imaging modality since its efficacy under medical imaging is still under study. In the University of Maryland, the researchers are testing a new method of X-ray imaging that uses color to identify microfractures in bones. So Dependent Pan explains that they use an element hafnium to navigate and attach to the place of microfractures, which is later scanned by spectral CT. He likes to call these particles as GPS particles. In the European Synchrotron Research Facility, they used KH subtraction radiography in bronchography. It was done as a part of diagnosis and research regarding the perfusion of lung in an adult asthmatic rabbit. CT reconstruction imaging obtained and in this research found out the exact regions of reduced ventilation of lung and non-uniform filling. In other research, Weston et al. Performed diagnostic lung imaging by dynamically recording the phase contrast imaging sequences. He demonstrated that insect respiration is critically dependent upon rapid tracheal compression in head and thorax. It was a mechanism that was not previously understood, but now it was understood due to phase contrast imaging. Very recently, a researcher team from Paul Scherrer Institute in Switzerland acquired three-dimensional imaging using high brilliance X-rays. This could be useful for studying the mechanisms of delicate insects and examining the 3D structure of intact viruses and proteins. All of these successful researches in animal models are the starting of newer diagnostic feats yet to be achieved for better diagnosis and treatment for the whole of humanity. Remember, I mentioned about Moniz and Sir W.C. Ranjan getting a Nobel Prize? Yes, but the most fascinating are their stories that led them there. Do you know that for the longest time, Sir Ranjan did not have formal education, or that he was expelled out of school at the age of 16, or that no other school wanted to admit him? Yes, those are all facts. But do you think that stopped him? No. He didn't stop trying. He persevered and finally got into a college, and later what he did is history. Sir Werner Fassmann. He is credited with the first cardiac angiography. To prove his point, he inserted a catheter into his own vein, which led to his heart, and hence he proved that cardiac catheterization was possible. Making history requires two things: perseverance and will. Perseverance while doing something, and will to believe yourself that possibilities lie in your hands. Do you know what the future holds? The undefined future has its arms wide open for anyone who is brave enough to define it, to think outside the box. Maybe in the near future, we are able to acquire diagnostically useful images with much lower energy X rays. Or maybe we will be able to efficiently diagnose areas of reduced ventilation in asthmatic patients, or be able to find heart blockages non invasively using particles containing hafnium. Or simply, we might be able to crack the exact mechanics and structure of coronavirus and hence help in the vaccine making. The best way to predict the future is to create it, to mold it, shape it, and fine tune it, tame it in the way that it best serves the betterment of humanity. Be you a teacher or be you a student? As a teacher, you'll have immense knowledge and experience about do's and don'ts, pros and cons. And as a student, you are naturally filled with overwhelming enthusiasm to make things happen, to try just one more time. Can you imagine the power of combining experience and enthusiasm? Well, it is the birth of magic. It is the birth of endless possibilities. You are the inheritors, makers, and shapers of undefined potential of the future. In your hands lies the ability to create the future that serves the betterment of humanity. Hence, I proclaim to you that in you the future of X-rays has just begun. Thank you.
Thank you, Julfarin. Judges, you can ask questions.
Yes, sir.
Hello. Koti sir is writing good presentation for you, Julfarin.
Yes, sir.
Yeah.
So your voice
Good
is
evening.
cracking.
Julfriya, good evening.
Zulfarin, sir. Good evening, sir.
Good evening. Well, presentation.
Good evening, sir.
I will ask
Thank
you
you, sir.
a simple question. What are recent developments?
Yes, sir.
What are recent developments?
Recent development, sir.
Yeah.
Sir, in X-ray imaging, sir.
X-ray imaging, CT, MRI, anything.
Sir, as in, if I start explaining, we first used to use computer radiography, which is now we have digital radiography, DR systems, which give you image can be acquired within seconds, and we also don't use cassettes for it. It is we have the detector which is already placed, and the patient is placed over there in front of the detector, and we take images on that. Same things are also used for dental radiography. In dental also we have CT dental, in which again a detector is used. Even in mammography, sir, like the newest will be, when it comes out, it will be phase contrast imaging. What else?
And
Yes,
CT
sir.
scan?
Not much.
CT scan? Okay, I will ask you
CT
one simple question.
scanning. Yes, sir.
When was it discovered, X-ray?
Sir, November 8, 1895.
November 18?
8, 1895.
In 95. Where all X-rays can be used? Where all X-rays can be used?
Yes, sir. Yes, sir. So, X-rays, they have a wide variety of applications. Um, like we know, at the airports, we use it for screening. They use it for screening the patients. I mean the luggage. Then we also have X-ray uses the microscopes, sir. Microscopes, they use X-rays when they want high resolution to be seen on it. Also, so the recent use in X-rays that NASA is using X-rays for communication in space. Earlier, they used to use radio waves, but since X-rays have even shorter wavelength, so they are promising that um, a lot of information can be sent and got with the same amount of energy that is used. Yeah.
Okay, thank you.
Thank you, sir.
Any more questions? Rameshwar sir?
Yes. Very nice presentation.
Thank you, sir.
Presentations, Wilfrin. I have one question.
Thank you, sir. Yes, sir.
Can we control necessary radiation and investigation, and how?
Can we control? Could you please repeat, sir?
Can we control necessary radiation and investigations, and how?
Control necessary radiation. So control necessary radiation as in radiation protection, sir. Sir.
Rameshwar sir.
I repeat this question. Can we control
Yes, sir.
Can we control necessary radiation and investigations, and how?
So, as in when we use control of necessary radiation would be, so as much as I can understand, it will be as in suppose we are examining a patient for hand, say maybe a wrist fracture. So controlling necessary radiation will be in a sense we can use the radiation exposure or of the MAS or the KVP in the range that will provide us excellent diagnostic accuracy, and also it will result in we not allowing a lot of radiation in the environment.
One more question. What kind of
Yes,
X-rays
sir.
can after the unborn child?
Yes, sir.
What kind of X-rays can after the unborn child?
So I don't understand the question, sir.
Hello, sir. Can you repeat the question?
I repeat this question. What kind
Yes,
of
sir. I'm
X-rays?
sorry, sir.
What kind of X-rays can after? Hello.
Yes, sir. Hello.
What kind of X-rays can affect the unborn child?
Okay, sir. Okay. What kind of X-rays, sir? A large dose of X-ray is detrimental to the patient. Hence, when there is a pregnant woman which comes into the X-ray room, we give her a lead shield which protects her from X-rays. X-rays can have deleterious effects by their nature. They go into the biological tissues and affect the DNA. So, in case an unborn child is radiated with X-rays, there can be malformation which occur in the child, or maybe or maybe there can be cancer of the child because the soft tissue of the child is not fully mature, and cancerous what do you call it, cancerous growth can occur very fast in that child. Yes, sir.
Thank you.
Yes. Thank you, sir.
Santosh sir. Santosh sir, any questions?
I cannot hear, sir. Hello, sir. Not audible, sir.
Julfarin?
Yes, sir. Sir, I cannot hear, sir.
Yes. Can you hear me now?
Yes, sir. I can hear you now. Good evening, sir.
Yeah, Julfarin. Yes, good evening. Julfarin, you have done a very well presentation. You are although second year student, but you have taken into the very deep of the starting from the X-rays and to the endless possibilities, how the X-rays started and how the equipment started and much more. But there is one more thing to be added. This molecular imaging and hybrid imaging are more recent advancement.
Okay, sir.
Molecular imaging and hybrid imaging are recent advancement in this.
Okay, sir. Thank you so much, sir.
Good, you have done well.
Thank
Thank
you,
you.
sir. Thank you so much.
Yes. Very nice, Julfarin. Any more questions from judges?
Thank you, sir.
No, thank you.
Okay. So, dear. Okay, we have finished all the presentations for today. Now we are going to have our guest lecture. Hello, Anto Ramesh Delvi sir, have you joined us?
Hello, Rana sir.
Hello, yes sir.
Take views of judges first, then we'll, after their views we can take.
Okay sir, okay. So now I request respected Ashok Walmiki sir to express his views. सर कुछ दिशा निर्देश भविष्य के लिए जो बच्चों को काम आए.
Good evening to all. I am grateful that I have been selected as a judge to this session. I also like to thank RAM and SIR for giving this great opportunity. भगत जी और मिश्रा जी, ये जो आपने ऑनलाइन जो पावर पॉइंट प्रोग्राम जो बनाए, ये सबके लिए बहुत यूजफुल जिस प्रोग्राम है, मैं उनको बहुत आभारी हूँ और सभी को ये जो पावर पॉइंट जो प्रोग्राम है स्टूडेंट्स के लिए और टेक्नीशियंस के लिए ये बहुत अच्छा ओरिएंटेशन प्रोग्राम है. तो मैं इतना ही कहना चाहता हूँ कि दिस ईयर गोवा में जो नेशनल कॉन्फ्रेंस था वही रंजन डे उसी दिन जो अभी जो चल रहा है नेशनल लेवल और वर्ल्ड लेवल में पैंडेमिक जो कोविड का जो समस्या है, ये समस्या से ये जो नेशनल कॉन्फ्रेंस कैंसल हो गया. उसी प्लेटफॉर्म में ये जो एक अच्छा प्लेटफॉर्म बना के ये जो ऑनलाइन पावर पॉइंट किया है, मैं रैम और एसआईआर को मैं आभारी हूँ, धन्यवाद सोचता हूँ.
Thank you Ashok sir, thank you so much. Now I request Santosh Kumar sir to express his views. Hello. Santosh sir, unmute your mic.
Can you hear me?
Sir.
Yeah. I would like to thank Mr. Trilokinath Mishra ji and Mr. Sankat Bhagat ji, our national coordinator for SIR, for this organizing this session of X125 for session 6 on national level, and this is online PowerPoint presentation competition for the medical radiography and imaging student across the India. And today 20 September organized by RAM Maharashtra. I would like to thank all the participants, all the 6 participants who have performed here online presentation. They have done all excellent. They are very good in studies, and I wish them all the success for their life in future. And this is a very good platform that we can meet during this pandemic session as online, and this is a very good program, and that students can learn more, and it's helpful for the students because most of the time we are more not free to do this, but we have time during this pandemic, and most of the students have attended this, and many of the students across the country have benefited this. So I would like to congratulate this team of Maharashtra RAM and the whole panel of judges here, and our guests who were there today, and all the students especially who participated here again. I wish them all the success in future. Thank you.
Thank you so much, Santosh sir. Thank you so much. Now I request Rameshwar Waghmare sir to speak few words.
Very good afternoon, everyone. First, I thanks to both teams of SIR and RAM for giving me this wonderful opportunity. Thank you. And especially thanks to National Coordinator Mr. Shankar Bhagat sir and Mr. Trilokinathji Mishra sir, President of SIR. Very well organized a national X125 national PowerPoint presentation competitions for medical radiography and imaging technology students. I will congratulate all the radiographers students. Each and every student performed very nicely. I would like to share some motivational thoughts with you. Dream is not what you see in sleep. It is the thing which doesn't let you sleep. Thank you.
Thank you, Rameshwar sir. Thank you so much, and thank you all the 3 judges, Santosh sir, Rameshwar sir, and Ashok Walmiki sir. Thank you so much for your guidance and the time you have given, and hope that this will again be in contact. We will be in contact. We will be keep on doing like this in future also. So we are really honored to have Anto Ramesh Delvi D sir. Anto sir, welcome you sir. Namaste Anto sir. Namaste sir. So we are really happy and really obliged to have Anto Ramesh Delvi sir with us. He is our guest lecturer. He is now working as a general manager, Columbia Asia Radiological Group, Columbia Asia Hospital, Bengaluru, Karnataka. He is a very motivational person. Whenever we meet, he really keeps on motivating us. Respected sir, Anto sir has started his career as radiographer. He has got so many degrees: BSc Physics, CT Scan MRI course, 2 years diploma, Master in Radiology, MBA Hospital Administration, PG Diploma in Artificial Intelligence for Leaders, and so many other degrees are there. He started his career and now he is working as General Manager for Columbia Asia Hospital, India. He is having 25 years of experience in radiology and hospital administration. And he is having so many responsibilities. Responsibility lists are long. So I will like to share with you some of this. He has started 16 hospitals in India, and he is involved in as project lead in green and brown field hospitals projects. He is having expertise in getting licensing work for hospitals, and he delivers ongoing support to hospital operational heads. He acts as the key interface area in hospital, diagnosis center, and so many things. So really, we are happy and we are honored to have you. Anto sir, I again welcome you all. You in X125 session 6. Sir is going to guide us, speak on statutory requirements in radiology. Anto sir, you can start.
Okay. Thank you, Ranaji, for the very kind introduction. And also, I like to thank Ram and also SIR national coordinators and the complete team members and the colleagues who are attending this session. So I will start sharing my presentation. Before sharing my presentation, I just wanted to talk about why this topic has been selected by SIR coordinators. You all study this 3 years degree and also masters and diploma, but basically everyone should understand, maybe it may be added to the curriculum in the near future. Already there are bits and pieces. Basically we should everybody should know about the basic requirement. If you are going to build a house, you should know about the land registration, the requirements, the power requirements, the building height and all. Otherwise, it will be, your dreams will be demolished. So our house and all, if you talk about, it may land up in some lakhs and crores, but any hospital project, it's in more than 100 crores to 200 crores or more than that. So without much wasting time, I'm just sharing the radiology requirements on statutory. So basically, if anybody have any So I'm starting the session, and as I begin with this, once again I thank Ram and the SIR team coordinators. And you all know that at this stage, my deepest condolence to the people who had lost their loved ones during the COVID-19 pandemic. And also we thank our frontline warriors, our radiographers and the doctors and all the team members of the hospital for risking their lives to save our country. So as you all know, this is very important permissions required by government and local authorities to start the radiology services, either it by maybe a private or government hospitals or clinics. There is an art of collecting all necessary permissions and periodic maintenance. This includes completely planning of what type of services you're going to have, and for that services, what radiology missions are required, including our radiographers and also the radiologist and the ground force required for the radiology run team. So there is a laid down statutory requirements by bodies like Atomic Energy Regulatory Board, which is a central government, and also District Health Office and Civil Surgeon Office, which is the state governments. Everywhere we have to follow the local state guidelines. So whatever I am going to explain you in this half an hour to 45 minutes, and you should know you have to follow your local state guidelines, because there is a slight difference, however it remains the same. So statutory compliance in radiology, just few lines. It is not an option for you, but it isn't mandatory. So every students who are starting their career in radiology, as leaders or the lecturers or the professors, has to mandatorily inform and make them to understand the statutory compliance, because these are some things which is going to appear in their exams and also in the interview. So this is very important at this stage. So let's make them little more understand about the statutory, because it's very important for the today's work and also for the today's business. Because normally this all acts are approved and also left for the public view, and it is published in the official gazette. So ignorance of law is no excuse, and those seniors who are attending here and those who are hearing us will also be with me, because anywhere we are not following the statutory guidelines, even the daily documentation of consent forms and pregnancy scans, including the consent forms for MRI, there is a legal liability. So we have to understand it is very important to follow the law. One should everybody remember, a spark neglected burns the house. This is, you have to understand, even some negligence will cause fire accident, where there may be people who are getting injuries, even including death, and there are the senior management people who are running the hospital, directors will be arrested, and it spoils the reputation of the group, and there is a huge financial loss. And please understand, there will be even people not getting job because they have to close the institute. So in order to avoid all these things, the government, the central government had laid lot of rules and regulation to start a radiology department and a diagnostic center. It may be in a small clinic leading to a teaching hospital. So during this time, there will be lot of other injuries and other accidents. To avoid this, for radiology setup, there is laid down policies and guidelines. Our major thing is mandated by Atomic Energy Regulatory Board, which is a central government. Earlier it used to called Baba Atomic Research Center, which is in Mumbai. They are very friendly, and they have a lot of guidelines to start a radiology department. Our radiology requirement starts from the time you decide on a radiology department, whether you are going to have a CT scan, X-ray, MRI, ultrasound, or over and above, if you want to have a radiotherapy, the guidelines are still more different, because from the day you start your land purchase, you should have a RSO in the place. So that is there. And always, now we are not going to talk much about radiation, MRI safety and other contrast related things, because there are other experts who will be joining you shortly. We are only going to look at what are the licensing requirement to start a radiology diagnostic department in an hospital or a standalone diagnostic center. ELORA is one thing which electronic licensing of radiation application system. Everybody should know from the day one you start a radiology process, you have to understand, because as a student, as an intern, and as a radiographer, you should be able to do. And it is applicable to diagnostic radiology, radiotherapy, nuclear medicine, and lot of facilities where they use radiation. I'm not going to talk much about here, because as I said, radiotherapy requires different regulations, and diagnostic radiology, we are going to focus on the basic startup of this, because the moment you start this hospital projects like radiology and radiotherapy, the Atomic Energy Regulatory Board has given a line by line items, and it is completely free of cost. Everybody has to understand this. Somebody supporting you on regulations, entirely zero cost. There is not even 1 rupee involved, but there is a step by step, and they are very friendly to guide you. Whatever you have doubts, they will clear you through online. And anything, like if you want to start a hospital, it starts from procurement approval of purchasing a machine. Either you are purchasing a new machine, either you are purchasing a used machine from some other vendor or some other hospital, or you are importing a machine which means, so there you need an NOC, no objection certificate. However, all the machines, X-ray producing machines, starting from dental machine till CT scan and the X-ray machine, mammography, cath lab, all machines needs a procurement approval. So they are given you. Because why we need good statutory compliance? Because it will give a good business house, and it gives a respect also, because legally you are following the country guidelines, so that including the course certification, you are recruiting only the people who are certified, so that everybody are trained, because there is a lot of radiation involved in this. People should have very good knowledge. This also will give the trust in the employees, not only our employees, the other people working in the hospital, and the patients will be happy, because you are going for other accreditations like NABH, JCI, and the other stakeholders, because they are investing in a very good statutory integrity and ethical practices. So always you have to understand, the investors want to know you are following 100% statutory compliance. The other hand, if you fail to violation, there is a huge liability, and again there is a huge things where your management things will spoil and the business will collapse. So let's look at the ethical and integrity practice, because already, as I said, there is no money involved in getting license in Atomic Energy Regulatory Board. So, and the one more thing attached in radiology is wherever you are purchasing an ultrasound machines. So it depends on what all things are there. So I'm going to take you through an X-ray producing machines. All X-ray producing machines, it starts with the procurement approval, where Atomic Energy Regulatory Board is involved. So you have to tell them that I am going to purchase this machine from this company. This is a so many MA machine. and this is a 16 slice or 128 slice or 256 slice. So you have to tell them and which model you are going to purchase. Before that, what the vendor will do is they will give that machine to Atomic Energy Board and test it, and they will find, okay, this machine is ready to use for public without any side effects or any danger involved in it. Means, so they test it for the output of the machine and they give the approval number for this. So there is a type approval for any machine you have to purchase. Colleagues and friends, whenever you are heading a radiology department or going to go start up in a radiology department, please don't mind asking questions, because you should have TLD badge, you should have licenses, and you should have proper licenses before you start. Because anytime if they are going to come for a surprise audit or an audit due to complaint, they will close the hospital and you are going to be out of the premises. So let's be very much vigilant on looking at all these X-ray producing equipment licenses. And when it comes to ultrasound, there is a PCPNDT Act where you have to get procurement approval for all the ultrasound machines, which company you are purchasing, and what are the probes going to be in this machine, and who are the doctors. So when it comes to Atomic Energy Regulatory Board and also to the PCPNDT, you have to tell the radiologist credentials that they are certified radiologists, certified radiographers, and these are the doctors who are going to handle these machines. So it starts with the license of the machine, it starts with the certificates of the doctors, and there are a lot of other licenses which is required to start up a radiology, which I will show you in the last few slides without taking much time. And the third important thing, as you all know, at this COVID situation, biomedical waste and infection control best practices is very important. Guys, COVID has taught you a lot of lessons, and you have a lot of state guidelines in different states, however, in different countries also. But please understand, COVID is same across the country, across the world. But if you look at your education or your radiology course in the earlier, already it has been taught to us, even for a tuberculosis customer, we have to wear a mask. But guys, we have completely forgotten about our best practices has been taught by our lecturers, the professors, and our tutors in the early period. But now COVID has taught us a lot of lessons. Now without a mask, nobody is coming out, and social distancing, hand wash. These all are the practices in the hospital. And as I say, my colleagues, in our hospital, definitely everybody are infectious patient only. So we have to be better careful. Considering the topic of statutory, I am moving on to the other things. There is MRI, radiation, contrast related issues, infection control, safety issues, but we are going to talk only about statutory things because this is our topic and you all should know there are other experts which will brief you about this. As I said, procurement approval, once you get it, you have 1 year time to get that machine, install it, do a testing, calibrate it, and then upload the documents in the Atomic Energy Regulatory Board portal so that they will issue licenses for all the machines, including from dental till the cath lab and the CT scan, so that you have 5 years of approval, which is you can use that machine. However, in between, if you do any civil changes in the building, or if you change the X-ray tube, or if you do any alteration in the machines, you have to inform the Atomic Energy Regulatory Board. Completely from A to Z, if you log into the eLORA portal, you will be able to find out all these things. So I will be ensuring that, because whenever they issue it, they issue the type of equipment, model name, license number for each of the equipments, and they ensure to inform you that you have to display the caution board in local language and the other languages like Hindi and also in English. The third language should be a local language. If you are in Gujarat, you have to use it. If you are in Karnataka, you have to use local language and the other states, because the people has to understand these are the places where there is an accidental exposure is possible, so they will not enter. Caution is very important for pregnant ladies in our department. So please ensure that all the equipment details, caution, everything should be available in English and also in the local language. This should be reflected in the consent form also, because for X-ray, you should take the last menstrual period for all female patients of childbearing age to avoid accidental exposures. guys, once whatever happened in this COVID time also I'm going to share. They are even exposing the pregnant ladies at this stage because they wanted to be safely handling the fetus and also the other people, like if the radiologist is doing an ultrasound or if the radiographer is doing a CT scan, they want to know this patient is free from COVID. That's the reason with proper lead apron providing, they are doing X-rays for even pregnant patients taking a consent. These all instructions should be displayed in the door, and please ensure you have to paste the copy of the ARB license on the door of an X-ray machine or a CT or cath lab. Wherever the door is opening to the room, you have to paste this license. This is a new regulatory requirement. Guys, you have a lot of seniors and experts in our group. Please try to talk to them and understand it, because this is going to be your lifelong work when you are going to start up a career in the radiology in India or in anywhere in the world. There are a lot of nature of licenses required. I wanted to just tell you quickly 10 points, which is very important. It depends on whether it is a clinic or a hospital or what type of mission. There are a lot of licenses required, and whether it is a private sector or public sector, definitely everybody should have Atomic Energy Regulatory Board. I want to tell you there is no difference, no doubts in your mind stating that, okay, I am a different company and all. Any company in India, if you wanted to get an X-ray machine or an ultrasound machine or a CT, you have to follow the guidelines, whatever I say. Investment, whatever, whether it is a local investment or a foreign investment, you have to follow. Geographical positioning, wherever in state, any state in India, this is applicable. And specialty of healthcare, you cannot tell that, no, I am going to do only organ transplant, no, I am going to do only deliveries, I am going to do only termination of pregnancy. Anything, anywhere, everywhere you require this Atomic Energy Regulatory Board and PCPNDT. Immaterial of your building size and design, whatever footprints you have, you should follow this Atomic Energy Regulatory. The fifth point is all the employees should be registered and they have to follow the guidelines also, because staff safety is also very important and the environmental safety also is to be important. As I said, you have to take all the approvals, including the nearby apartments or houses are there. You have to ensure that, because the wastages you are going to generate a very large number, it has to be discarded appropriately. When it comes to nuclear medicine and radiotherapy, as I said, there is a different clearance. Definitely, all things are available in Atomic Energy Regulatory Board. Please follow the guidelines. Lifespan, as I said, license to license it differ, because RSO license will be for 3 years, radiological safety officer, and all the other licenses will be for 5 years. You should submit the layout. And one more important thing is you have to plan the layout, means the room size according to the Atomic Energy Regulatory Board. Sometimes they used to give false information in the internet or false information in order to get the approval. Guys, this is cheating ourselves. We have to ensure that you should not wear your helmet after seeing the police or the traffic police. It is something which is going to save your life and also save the public and also the radiation zone in the hospital. So we have to ensure, even in your interview, you can ask the people whether you are providing TLD badge, whether this ARB approval is there, whether the walls are built as per the ARB guidelines. So that is very important to you all. And lifetime validity for other licenses is available. And as there are other licenses also which is related to hospital. So you have to follow this renewal. Why I am talking this, I will show in the last slide. So there is a 5 phase in applying all these licenses. Before starting a radiology department, you should have a certificates, documents of complete issuing agency of phase 1, where you will be getting the pre-building approval, and also completely you have to get the clearance from fire safety if the building is above 15 meters, and the approval of the land, as I said, nearby apartments, everything. The second clearance is the requirement of electrical things, which is required for all your hospital departments. You have to inform the electrical department that I am going to have 128 slice CT or 256 slice CT, because based on that, they will be giving you the power supply and the licensing, because this is very important. However, you will be having some UPS backup also. Trade license is very important. These all are very important to get your ARB approval. So that's the reason I have taken this occupation certificate and all, because ARB wants to know whether the local state clearance is there to run a hospital. because they cannot monitor each and every hospital in the country. If you look into Atomic Energy Regulatory Board website, you will be able to get how many CTs is installed in India, how many X-rays is installed in India. However, MRI doesn't have any regulations, but you have to follow the zoning thing, because zone 4 is high magnetic field. You all know the accidental thing which used to happen. Majorly, at one point, I want to tell you at this stage, even though it is not my topic, pacemaker screening is very important when it comes to zone 4. So please be very much careful. See, you have to spend some time in this type of regulatory work wherever you are. Don't tell it is my in charge work, it is my senior work. No, guys, it is our teamwork. You are working for a radiology profession. Everybody should have knowledge about whatever work you are going to do. When it comes to your personal house, wherever, even if you are going to rental, ensure that you have all documents in place in a proper name, because anytime you will be in middle of the road, or they will be asking you some high penalty. So you have to ensure that these things are available. The phase 4 is very important, because you have to get license for all the medicines, because now contrast also comes under medicines. So you have to understand that it should be available for radiology services, because sometimes they use narcotic drugs for sedation of patients. So guys, the phase 1, 2, 3, 4, whatever I have spoken is the requirement for certain hospital and not for most of the clinics. But however, you should have a thorough knowledge, because it is like a relay. Without all these things, Atomic Energy Regulatory Board will not allow you. And you have to get an hospital registration for this. And majorly this biomedical waste is very important license, where you have to get it, and you have to tell how much waste you are going to generate. So now HR related is very important, because you are going to hire radiologists and the radiographers for this, and you should ensure that you have to follow the ARB guidelines, whatever they say. They say that at least a radiographer should have 1 year certificate with a good knowledge of radiation safety and quality. So this is a very important slide on radiology, where the PCPNDT registrations, some hospital combine with MTP registrations also, and you have to have an RSO for diagnostic radiology also. An RSO, any radiographer can become as an RSO, where you should have 5 years of experience minimum with a good knowledge of CT and cath lab, because he is going to look after the safety, and he has to know that he has all licenses related to the machines and appropriate lead aprons, lead gloves, lead goggles, and the thyroid shield and the gonad shields. Everything should be in place. When it comes to cath lab, there are some lead flops which is available. This lead flaps should be available either ceiling suspended or even at the ground level, because this is going to protect the interventional radiologist or the interventional cardiologist, and also our radiographers team members who are going to work there. And TLD badges is very important. There are some wrist badges and rings also available as a dosimeter. So this phase 5 in an hospital starting is very important, where all radiology is very important, guys. So please don't forget this at this stage. Wearing mask is very important. Don't forget about this. Don't think patient whether it is positive or any serology positive like HIV, hepatitis, or even hepatitis C virus. Please ensure this all are nothing we can do. Only thing is we are in a field where our social responsibility is to treat this patient without hurting them and give them a good care, because we are going to be in this field in the radiation and also in the infection lifelong. So guys, we have to protect ourselves. By doing this, our juniors and our students who are monitoring or who are under us also will learn best practices in order to this, because we are going to help this profession. So your work is going to stay lifelong in their mind of the juniors, radiographers, and also the students. So please take time to teach the people or the students wherever you go and give lectures on important things, that wearing mask is not only for COVID, it is a requirement in radiology, because any patients may have any pathology, and that pathology is, even if they are asymptomatic, it is better. You cannot know about this, so better to protect and keep washing hands. And how to handle the patient, you all know about social distancing. Even in radiology basic course, they used to teach They don't talk patient face to face. Patient should be turning that side. You should be taking history this or the other way, so that there is no direct contact because of droplet or even the cough or anything. Everything has been taught. Only thing we have been not following at this stage. However, we have to thank at this stage everybody are very much vigilant in wearing mask, washing their hands many times. Definitely, it's a good thing what is happening. And the last requirement is the ambulance facility, because we have to understand. Again, I'm telling, please follow the rules and regulations, follow your state guidelines, because most of the things are very important. And the last few slide is this tracker is very important for you. So as a person you are working, don't look at your designation, or you can ask your manager itself or your radiology in charge, can you please show me the law and regulation tracker? What are the licenses for run to radiology? Where is the original lying? Who is the custodian? And when it is going to expire, so that you will be having knowledge. There are now artificial intelligence, which is a new technology which has come and which will pop up and tell Mr. Shankar Bhagat, your license is going to expire. So he will have immediately to do the requirements, because any renewal should happen 1 month, means 30 days before that, including the PCPNDT renewal of ultrasound, because it takes at least 30 working days for them to renew it and give. Guys, it is like your two-wheeler license or your driving license or your insurance for your medical. It is very important. At the middle of some sickness, if you find it is expired, then we are going to lose some loved ones, or we are going to they are going to close this hospital. So please ensure not to give. They are not so much stringent. They are very helpful in helping us. So let's not do it as we have to take this as a duty, and we have to ensure that we have to have a tracker. Every 6 months I have put. I have not put on every day. I didn't put every month, because there is no license which is going to expire 6 months. Minimum 1 year or more than above. So when you're doing a 6 months review, you will definitely know what is going to expire in the next month, so that you will be able to do the required documentation work, and so that you are 100% compliance on the statutory regulation. It is very important. You have to pay attention to the compliance, as because be prepared for multiple visits to your license. And also, if you are handling a lot of units, like some seniors are handling 5 to 10 units, and engage professional consultants. If you are very busy with the clinical work, and if you are not able to monitor, have some consultant, because you know your LIC agent will send a message, sir, your LIC is going to renew due on next month. See, they are helping you. So you have to go for this, and do not underestimate statutory compliance. As I said, there are a lot of issues. Please be 100% compliance. And this is my last slide. Don't compromise on statutory compliance, guys, and follow state guidelines. This is very important to you. Focus on documentation, because there are a lot of consent forms. There is a TLD reports, your dose reports, your consent forms for pregnancy ultrasound, Form F for non-invasive scans, and Form G for invasive scans is very important. So your documentation with complete consent forms are very important, including the date, time, and the language, whatever you have explained, the consent is very important, because to avoid any legal case or a medical legal case against you. Why I have put resignation is, lot of time, lot of people keep changing in the private sectors. So during that resignation shift, if you don't take the handover, then there will be a gap, huge gap in the documentation work. So please ensure that during the resignation, hand over the documents to your colleague, because it's our profession. You may have some hard feelings in your institution when you are leaving, or you may not get a salary, you may leave for some other reasons, but please ensure the other colleague is our friend. So let's hand over the documents properly, and there should be one point of contact in the handover always, so that, because no, most of the hospitals, when I go for NABH inspection or when they come for a JCA audit, they used to think that, okay, that person has resigned, so there is a huge gap where they didn't receive the license. So you should have always one point of contact, and during all resignations, there should be a share folder, and that should be a relieving document whenever you are relieving. Because in most of the government hospitals and private, and major some of the teaching institutions, we have some seniors who are working for a longer period. They do very good documentation. License tracker is very important. Please maintain it. Always you should know who is who know your issuing authority also. Example, you should know all the X-ray licenses issued by Atomic Energy Regulatory Board, and the issuing authority name, everything is given in the ELORA, so that you should have a good rapport. Always keep this as a training every 3 months to 6 months for your juniors, for your people who are newly joining, so that once again you will have an update. And this is very important for anybody who is going to join in our profession. Guys, if you have any questions, I am happy to answer you all.
Nagaraj sir is having question. Can we make automatically renewing licenses by online?
Currently, we don't have automatic renewal license by online, but everything is available by online. Only thing we have to submit. We can keep an automated reminder online, which is available in Excel. But as of now, we have to online submit it. So currently, they have not made it. But definitely, with the new trends happening in our country, there will be, because no, see, earlier it was all paper post. Now we have moved to this online. Definitely one day we will be able to get the online regulations also, but as of now we don't have it. Only thing, we have to submit everything online, and some state where we have to go in person and submit the documents and get an acknowledgement. But there is a 30 months period.
Okay, thank you. Any more question? If anybody is having question, you can write in the chat box. I think no questions are there. If you have any questions, you can post in comment box. I think, sir, you have explained so nicely that there are no queries, and you will be available 24/7.
Yes, and anytime, one thing I forgot to tell you all, I used to support all the hospitals in India and even out of a country when it comes to regulations. We don't charge anything. It is free of cost, and please try to use us because it is our important profession. We don't want our colleagues to suffer. So if you wanted to, because no, we are just upgrading you, and we are explaining you what we have learned from our seniors. So there is no things in there. And somebody has there, they've asked about JCA radiological needs, and the Joint Commission international needs are nothing but, again, they will look into Atomic Energy Regulatory Board licenses, your PCPNDT licenses, and your biomedical waste license. Plus, one very important thing they look at it, this any accreditation is, they want to know that training has been done to the radiographers every month, at least minimum 6 to 8 hours. That is one thing, it's very important for them to require. And in that training, you should talk about radiation safety, MRI safety, contrast reaction allergies, extravasation, how to handle, and the other documentations related to their dose, everything. So that is the reason. So anytime, anything, if you wanted, please suggest. And whenever you go to some colleges, please try to talk about this PPT. You use this PPT, you can take this PPT, you can put your name, and I am very happy if you are going to update the student professionals who are going to come to the, because they are going to be the future. So please, wherever, whichever college you go or whichever sessions you do, at least update them on this, because most of the interviews now they have started asking these questions. Sure, I am sure it is good. It has come in DNB doctors exams also, radiologist exams. So that's the very important thing I wanted to call you. Who all are handling CT equipment is this question which they have asked it. Actually, as per the Atomic Energy Regulatory Board, it should be a radiographer, but he should be a certified radiographer, minimum 1 year diploma, and it is the hospital authority to allow them. And one more thing you have to understand is, whenever if you have to understand, if you in the ELORA, you have to register the radiation workers also. If you look, I can show you my name in the ELORA. So if you are all are a certified radiographers, you can upload your documents and you can get, but for that you require a TLD and the appointment letter from your hospital, so that it will show as a radiation worker in your name in the ELORA portal.
Okay, thank you, sir.
So all the technicians has to be trained. See, one more thing you have to understand. Some people will have degree or master's degree, but their knowledge level may be less. Maybe in 100 people, 1 people or 2 people I'm talking about. It is not their fault. It's the fault of the institute where they studied. That's the reason wherever you have been called in any institute or anything, look at the education ways and give your suggestions, so that it is very helpful for our profession to build a future. Because no, at the end of the day, it is our radiographers. It's our team, it's our family. So there is nothing to ask lot of questions, whatever they don't know. It is our duty to explain them and motivate them and make them to learn, because they are going to talk about tomorrow. Rana is the radiographer in charge who taught me these things and all. So it is like how we put seed for plants. We have to clone ourselves. We have to have 100 Shankar Bhagat. We have to 100 Trilok Mishra, Popliji, anybody. So unless they all seed it now, we are not going to see any Shankar Bhagat or any Trilok Mishra in future. Thank you, team. Thank you for your patient listening. What are the rules regarding the injecting of contrast media to the patient? Can radiographer inject the contrast? Very good question. Actually, a nurse, as per the NABH accreditation and the JC accreditation, only a nurse, trained registered nurse, can do it. But however, there are emergencies. If you look at earlier 90s and all, only radiographers used to put in diagnostic centers. But now the regulations has come. But still, for medical emergencies, if you are a trained expert, definitely you can utilize your expertise, providing there is no danger or something happening to the patient life. But if you look at law regulation, only a nurse is authorized or a doctor is authorized to put an IV line and to inject the contrast. Our duty is to monitor and do a protocol required for the medical requirement. Means you should be an expertise in doing a quality image required for the clinical problem. Thank you.
Thank you, sir. I think there are no more questions.
Guys, some of you have asked my email ID. It is in the last slide, and you can just look at it. And if you, I'm just sharing it. You can see my, are you able to see my last slide? So you have my email ID and mobile number, and I am available in Facebook also, and it's like sharing knowledge. And one more thing is, I want to tell you all, it is not my knowledge, it's shared by my seniors. So definitely you have a lot of expertise in our SIR group also. So let's join hands and keep learning and share, because everybody have one talent in each of the things. So let's share our knowledge and grow as a very good professional in this country. Thank you.
Definitely, sir. These associations are working for this only. We are really lucky to have SIR, and we can share our knowledge with the experienced person, and experience matters. Thank you, Anto, sir.
Thank you, Ranaji. Thank you all. Thank you.
And hope we will meet again in
sure.
the session 7 of X125.
Yes,
thank you so much. Thanks, one and all. Shankar, sir.